Welcome to another episode of the Hack My Age podcast. Today is a solo episode. I haven't done one in a while. These take time to put together. It's not as fun as I always think it will be, but I think they're very valuable because I very often target the questions that get asked me over and over and over again. And today's episode is about the side effects of hormone therapy for menopause. What's normal, what's not, how to fix it. Okay, I'm going to give you some tips on that. So if you've started hormone replacement and you're not feeling great right away, don't panic. You're not broken and your hormones aren't broken either. This is absolutely normal. Okay, just to remind you, I am going to give you some rabbit holes to go down to figure out how to adjust your hormones, but please go talk to your doctor about it first. Okay. I'm not a doctor, and this podcast isn't medical advice. This is just pure education. And I want you to understand what might be happening in your body and then how to have a more informed conversation with your healthcare provider. So keep that in mind. Hormones, they're not always a perfect match the first time. In fact, when I was going through Dr. David Rosensweet's Menopause Method, this is a program he created for practitioners who actually are prescribing to their patients. Although I'm not a doctor, they are allowed to take that program through the Institute of Bioidentical Medicine. It was amazing. Dr. David Rosensweet is a doctor who has had 4 decades of experience treating women through menopause. Okay. And what he taught us was that about 25% of the women in his clinic are given the perfect dosage right from the start. Okay. When you are starting hormone therapy for a patient, you have to start somewhere. And if the patient is not a sensitive type, if they're sensitive type, or maybe they're older, they haven't seen hormones in a long time, you want to go like very low dosage and increase the dosage. But you may have a patient who's just got all symptoms under the sun and she needs a little bit more of a robust dosage. So usually it's only about 25% of the women who get it spot on. They feel great from the very go. And then they test and they see that their hormones are actually in that sweet spot. It's like these, what Dr. David Rosensweet called these gold posts that he likes his patients to be in. So then that leaves about 75% of the women who are not getting it from the get-go. So you are not alone. This is normal. Okay. He also mentioned that 25% of his patients would feel good right away. But then when he tested them, they were either underdosed or overdosed because he wants this sweet spot where you are lowering the risk of certain diseases of aging, but yet not overdosed. That means then 50% are really not feeling anything, or they don't feel good, or they feel worse. So again, don't worry, you're not alone. So for most women, side effects are really minimal. Okay. And the benefits can be incredible once your levels are balanced out. But I want you to keep in mind, it's really important to remember that the kind of hormones that you're taking make a big difference. Okay. I'm not going to go into the details on bioidentical hormones versus the synthetic ones. And it sounds like, oh, this is good, this is bad. I don't like making things black and white and good and bad. It's just that synthetic can be great for some people who cannot do bioidentical. And then if we demonize it, then that person obviously feels really bad being on synthetic. Sometimes we need to use the synthetic stuff. So it's just that there are lower risks when you're using bioidentical hormone therapy. So we try to start with that first. So here are the possible side effects that can happen with your first journey into using hormone therapy for menopause. So number 1 is breakthrough bleeding, or some kind of bleeding, right? It could be even like a normal period for you. For me, I have bleeding and it's like my normal period most of my life. It's been pretty light and just a few days and no big deal. So this is for women who have a uterus, by the way. Okay. So your uterus starts to grow when it's exposed to estrogen, because those estrogen creates these things called growth factors. And these are the same growth factors that help us repair and rejuvenate. It's fabulous. We want things to grow, not everything, right? We don't want our uterine lining to grow too much, but usually what happens when it grows too much, it's like a stack of cards. Then it becomes unstable and then it just falls down and it sheds unpredictably sometimes. Sometimes it's predictable. If you are on cycling your progesterone, for example, you kind of know when it's going to happen. But don't worry, this is totally common and it's normal within the first 6 months of starting HRT. But if it's too frequent, if it's irregular, then you talk to your doctor to rule out any uterine issues or cancer, right? It's not common, but it can be. So the fixes that your doctor may talk to you about is either maybe lowering your estrogen dose, but then the risk of that may be your hot flashes come back or your sleep is worse, or you want to find the sweet spot. Another thing your doctor may try is increase the progesterone. Okay. And if you are cycling, a withdrawal bleed, cycling meaning cycling your progesterone. This means for 2 weeks out of the month, you are taking progesterone. And for 2 weeks out of the month, you are not taking progesterone. And this is what we call cycling progesterone. And when you do this, a bleed is expected. It's quite normal. So if you are following Dr. Felice Gersh, she's another doctor who's been treating women through menopause for 40 years or so. She loves to get her women to bleed. She would say, this is what we're searching for. This is what we know. You have enough estrogen and your progesterone is working. But if you don't like it, well, then you can take progesterone every day, or you can just stop for a few days. It's a trial and error thing that you work with your doctor. Now, if you are at high risk for uterine cancer, you have a family history, or you have diabetes, you have hypertension, then ask for an ultrasound to check the uterine lining. And you should be checking the uterine lining anyways, year after year, but you may want to be doing it more frequently. Or if you are unsure, it's so simple. It's an ultrasound. Number 2, breast tenderness. Your breasts may feel tender. They may, soft to the touch. You may be fullness. You may be itchy. You may have sore nipples. You may tender nipples. Usually it's on both sides. And this often means it's a little bit of an excess of estradiol. Now, Dr. David Rosensweet, he would teach his doctors to treat their patients to keep increasing estradiol until they feel breast tenderness, and then you take them down, because that's how he likes to see where it is. So it's not like this is a horrible thing. Some doctors use it as a measure of how much is enough. And so what you may do, or what your doctor may do, and of course, don't do any of this stuff on your own. Do it with the guidance of your doctor, or ask your doctor, send an email, get in touch. You can lower the estrogen or increase the progesterone. So if you are on an estrogen patch or gel or cream, you can stop it for a while, and just a few days, I guess. You usually would take about, I don't know, everyone's a little bit different, a few days or a week, and you will stop having that breast tenderness. It should stop right away. But do this while continuing with the progesterone so that you can isolate the cause. Now, if the tenderness goes away, then you can try resuming your estrogen, maybe at a half dosage or some lower dosage. Again, talk to your doctor about this. Now, you can also, and if that doesn't go away, you can try taking out the progesterone, okay, and see how that works. Now, your doctor may want you to go back on the estrogen and then do the progesterone. Again, there are so many ways you can do this, but you can try taking out the progesterone and see if the progesterone was the culprit. That can also be. It's usually estrogen, but can be for some women progesterone. Some women feel that when they put progesterone directly on their breasts, they alleviate that breast tenderness because it's sort of balancing out the estrogen. Some women feel worse, our own journey. Now, Dr. Felice Gersh, she would recommend, she tries all these things too, but she also recommends you can explore iodine-rich foods like wild-caught fish, seaweed, kelp, algae, or even iodine supplements with the guidance of your doctor. And she says that can sometimes alleviate some of the breast tenderness, but getting to the root cause, like why are you having, if it's excess estrogen, well, then I would get to the root cause sooner than adding iodine. That's just me. And then you can also talk to your doctor about DIM. It's a supplement, DIM, and that can help metabolize some of the excess estrogen if that's the culprit. Because sometimes you need enough, but not too much. And then you want to be able to get all of your symptoms alleviated, right? So don't worry. Tenderness is normal. It can disappear after several months or as you adjust your dosage. So talk to your doctor about that. 3, facial hair, acne, oily skin. These are signs of excess testosterone. It usually happens more with somebody who's injecting testosterone. I have yet to see a woman who's using creams and using that much cream to get these side effects. You may get an odd hair on your chin, but it's not going to be anything quite excessive. But if you notice that your hair is is growing in certain places, or you have some hair loss. If you have a very high testosterone, you can have even a deepening of the voice, and some of these things are irreversible. So you want to be testing your testosterone if you are on testosterone therapy. This is usually a blood test, and it's not just testing your total testosterone. Your doctor will probably know it's your free testosterone or bioavailable. SHBG, sex hormone binding globulin, is another marker to look at, or albumin, because when you test testosterone, it's not just total testosterone. We want to see what's happening. Check that out. Make sure you're testing, measuring, and assessing, and seeing if your testosterone is too high. And the quick fix is obviously lower the dosage or you stop. You can also change the formula. Sometimes that helps. But again, usually with these strong side effects, comes from injectable. But again, everyone's different, and you may be reacting to the cream or the gel. The other thing that testosterone cream does in transdermal, in gels and creams, it can make hair growth, unfortunately, not on the places you want to, like your head, but I would rub testosterone cream when I first started on the back of my knee. And one day I woke up and I had this big, hairy back of my knee. It was so weird because I did laser many years ago, and I don't have hair so much on my legs anymore. So I saw this patch, and of course that's testosterone. And what I did, the quick fix, is I would put it on my belly where I don't have a hair follicle. You could put on the inner forearms, but I already put my estradiol on my inner forearms, so I don't want to mix them up. Sometimes I do. Actually, this morning I did, because I'd already dressed and I thought, okay, I sometimes rotate. It's not a big deal, but you don't want to put it where a hair follicle is, because then it may hair growth, but it doesn't happen. Like, I was wanting to test out if I could do my eyebrow or just in my hair. My husband's bald. Like, why can't I rub it in his head and make hair grow there? I don't know. Someone else can figure that one out. But that's number 3. Number 4 is if you're starting HRT and you're feeling groggy, anxious, or even have insomnia, and you're taking progesterone and you're like, why does everybody say I get good sleep and I'm having the opposite effect? It can happen. And it's the progesterone that's the culprit. And that's because women who are taking oral progesterone, it gets converted into allopregnanolone, which is a metabolite. And this helps us feel sleepy and calm and relaxed. And it's the calming hormone, right? It's a wonderful, wonderful hormone. But some women feel the opposite effect, unfortunately. And this can happen sometimes with vaginal progesterone or putting it up vaginally or in creams. It's rare. It's much more rare. It usually happens with the oral. But that doesn't mean you have to stop progesterone, because if you are taking estradiol, well, you need that progesterone to balance the uterine lining, especially if you have, only if you have your uterus intact. So what you're going to do is talk about changing either the dosage or the route of delivery with your doctor. So if you're on 200 milligrams of progesterone, maybe you're better off with 100, or maybe you need to have one made that's 50 milligrams for you. 50 grams, that would be a lot. 50 milligrams. So you can that's what we have compounding pharmacies for, because you need special dosages. So this is a discussion with your doctor. You can also change the route of delivery. So if you are taking 100 milligrams of progesterone, Dr. Felice Gersh, she did a great video, and I should share this, where she within her program, which I've done as well, she explains that if you can take your oral progesterone pill and put it up vaginally, you got to get it in there real close to the cervix, like get it up there. And that will avoid those negative side effects, the grogginess, anxiety, and insomnia. So if you are looking for those benefits of better sleep, it's not likely to happen because you're not converting it into allopregnanolone. Maybe it is possible that it converts a little bit, but it's usually no, that's not the case. Check with your doctor if you can do this. Use it vaginally instead, because you still want to be taking your progesterone, most likely. Dr. Felice Gersh, she says that sometimes none of this stuff works. Okay, even vaginally, even creams, nothing seems to work. Women are really suffering. They need the progesterone to protect the uterine lining. So this is the rare case where she would use the synthetic progestin. Okay, it's not progesterone, it's a synthetic type of progesterone. And she would use it intermittently, like every 3 to 6 months. And it's just to induce a bleed. It's just to shed that uterine lining. And then, of course, getting regular ultrasounds to make sure that what she's doing is working. So have that discussion with your doctor if you're feeling like that. Number 5, skin irritations. If you have itchiness or redness where you're applying your hormones, it could be that you're reacting, if you're wearing a patch, you're reacting to that glue that's on the back of it, or maybe you're reacting to the carrier base, the cream or the gel or the oil that you're using, and it's not the hormones, it's the actual stuff that's carrying the hormones. So you can try a different brand, a different base, a different delivery method. You can use a cream instead of a patch or a vaginal ring. Vaginal rings can also cause some irritations. It's kind of rare, but anything's possible. So the good thing is that we have lots of formulas. We even have sprays. I used to love that estradiol spray. It just dries in a second on my arm, but I wasn't absorbing it. But if you do, it's such a great delivery method. But anyways, check with your doctor. Number 6, headaches or migraines. Headaches are kind of tricky because they can be caused by hormones, or they could be stress or something else. Like there's a billion and one reasons why we may have a headache. When migraines, when they happen, if it's because of your hormones, and it's usually when estrogen is too low, but they can also happen when it's too high. So if you're on a patch, this can be releasing estrogen a little bit too inconsistently, and that may trigger some fluctuations and then the headache or the migraine. So you can switch to a gel or a cream, and you try to search for a bit more steady levels, because if you do gel or cream, you can do it every day instead of sort of a bolus, like especially if you're doing an injection, you get one big bolus and then nothing, or pellets, which I'm not a fan of, but again, it fluctuates too much. So I've had a couple of girls in my community who have had migraines, and one of them, she switched. She was taking her estrogen vaginally, which was triggering the migraine. They were bad migraines. And I think she was taking it a few times a week. And so instead, she started taking it every day, and that was gone. No migraines. That's because probably she was a little bit too low in estrogen, or it just was the fluctuations that were triggering the migraine. So also, if you are using a compounded estradiol or estrogen, you can also ask the compounding pharmacy or manufacturer about this and see if you can get a different formula as well. That can sometimes be the reason. Okay, number 7, some of the serious side effects, but they're really rare, but it's important. So if you are taking oral estrogen, which we don't encourage, we always want to try transdermal estrogen, you're at a higher risk for having blood clots, heart attack, and stroke. So this is why we try to avoid oral estrogen, and doctors kind of like can not worry about it if you're just on a transdermal, because transdermal estrogen does not have any of this increased risk. So nothing is 100% risk-free. We're just trying to get you as close to zero as possible, whether you're on hormones or not. Okay. So the key is to understand your own personal risk and then monitor appropriately. So if you must take oral estrogen, and again, like Dr. Felice Gersh giving progestin, I mean, sometimes it's the only way. And most of these menopause doctors say any hormones is better than no hormones. But again, it's your body, your choice. You have to always look at the risk versus the benefits. But if you are taking oral estrogen, then you have to really look at your cardiovascular markers and especially your history as well. Number 8, weight gain. Estrogen should not cause weight gain. Although I've get plenty of women who swear that it's the estrogen that made them gain weight. I also hear women gaining weight without taking hormones, right? It's in the large randomized controlled trials. It shows that women who are on estrogen gain less weight and they have better blood sugar control, because as we're going through menopause, many of us, not everyone, are more insulin resistant, meaning we can't eat the same things and our diet hasn't changed, exercise hasn't changed, and we are still not able to pull out the sugar from our blood, right? And then we get stored as fat. And this is poor blood sugar balance. And this is very, very common, very common. And if you are a diabetic or you're wearing these blood sugar monitors, you will see as you go through the menopause transition, you need more insulin, right? It's just a fact. So if you are on hormone, and the women who have taken hormone therapy, when they are diabetic, they will see they need less insulin. Most of them, not everybody, but this is the information that I get from diabetics. Some of the reasons you may be gaining weight is because there is some kind of imbalance with estrogen and progesterone. You may be estrogen dominant. And if you are already estrogen dominant and you're given more estrogen, you're adding fuel to the fire, right? So we need to figure out, get that balance right. It could be that you're not detoxifying estrogen very well. Your liver is not processing it. And this is really important because estrogen, no matter if it's your own estrogen or if it's something you're taking, it sits around in a toxic state and waiting to get detoxified. And that's what your liver is supposed to do. But if you are, say, drinking alcohol, that takes a priority. That gets detoxified first. And so estrogen has to take a back seat and recirculate in the body in a toxic state. That's no good. Okay. So we have to look at all factors, not just our hormones, but you can take tests. You can test through urine. You can test the metabolites to see if you are detoxifying your estrogen in a safe way and if it's detoxifying well. And then your doctor should be helping you learn how to detox better, whether it's taking a supplement or changing diet and lifestyle. There are many things we can do to make sure our detox pathways are open and doing well. You could also take a look at your testosterone if you're taking testosterone, because that can convert into estrogen. Maybe you're converting it, not really using it as testosterone, and then it just gets converted into more estrogen. So take a look at that. And that's why we test, measure, and assess. And that's why we work with menopause doctors to figure this out. So ask your doctor to test. It can be serum, urine, whatever they like. Just say, I need to see if I'm detoxing this well. And then you support your detox pathways through nutrition and also your gut. Your gut needs to be good. And who has a good gut? Very few people during this transition. So we need to make sure our gut is in a good state to help us with all of our hormones. So work with your practitioner to fine tune some of these things. And the other thing, some women say it's weight gain, but in fact, it's maybe a bit more bloating, water retention. And this could be either a temporary thing that will rebalance itself after a few weeks, or it can be progesterone. Progesterone sometimes causes bloating. So you may want to ask your doctor if you can pull back on the progesterone or change the dosage or, see if it's the progesterone that's causing that or not. And then the last side effect is that there is no side effect, that this doesn't work. Sometimes women say, I just don't feel any different. And that doesn't mean that the HRT isn't working. It just means that your body may need more time or just a different approach. So again, we have so many different delivery methods and routes and dosages and formulas. Speak to your doctor about it. See if you should be increasing the dose or decreasing it, or if you should be taking a gel instead of a cream or an injection or something else or a different brand. There's so many different things we can do. You can also try different application sites. Maybe the inner thigh is not your place. Maybe you need to do it on the inner arm. You can also use a symptom tracker to help you figure out how you're feeling and if this is a progesterone, estrogen, or testosterone excess or deficiency. I've got a little guide that Dr. David Rosensweet created for his I guess, students. And I have that guide in the show notes, and it's going to help you figure out if you have an excess or a deficiency. Then you can share that with your doctor and say, I suspect this. Let's mix things up. Okay. So this is about optimizing your hormone, not giving up and saying, this isn't for me, this doesn't work, I feel nothing or I feel worse. It's absolutely normal to have these side effects, and it's just temporary. These are not big things, other than the oral estrogen can be a big deal. But if you're taking the bioidenticals and you are working with a good doctor, you will find your optimal dosage. And I always recommend testing, measuring, and assessing. Even though some doctors poo-poo testing, I think tracking things over time. It's not just looking at your progesterone levels. I'm talking about your insulin, your cardiovascular markers, your cholesterol, your LP little a. You're looking at bone density, bone strength. There's so many tests that we can do, and we see trends over time. And if we're not trending well, then it gives us a clue to either change our diet and lifestyle or change our hormones or whatever it may be. Don't stop testing. Test your uterine lining. Do some breast screening. Like all these things are very important. So please don't just think I'm testing my estrogen. There's so much more to that. So if you have any of these side effects, don't give up too soon. No, these are normal and it's just part of the process. Hormones are super powerful. They influence everything from your brain to your bones, and they affect other hormones as well. It's the balance that we need, and that takes a little bit of patience. And again, hormones are not for everyone. If you say, you know what, I've done it all and I've tried this and I've tried that, it's just not for me, that's fine. That's okay. There are other things we can and should be doing, whether we're on hormones or not on hormones. You can protect your bones, your brain, your heart, your breasts, vagina, everything without hormones. It is possible. Now it's hard work, of course. And sometimes it's harder when you're not getting good sleep because you got hot flashes, but there are things that we can do and should be doing anyways. And again, if you're testing, measuring, and assessing whether or not your hormones, you will see if you're trending right and if there's other things you need to be doing. So the goal is to really understand your options and do your research and work with somebody who listens to you. Biohacking menopause is about understanding how your body responds to different treatments and different things that you're throwing at it. And it's just to figure out your biology and where it is, and maybe very different, and likely is very different than your sister, your friend, your mom, everyone around you. So don't give up. Biohacking menopause is something it's not about just wearing gadgets and looking at blood markers and doing red light therapy. It's about usually the basics, the foundation. Join us. Actually, if you need a little bit of support, you can join the Biohacking Menopause membership group. This is a women's only private community where we meet with guest experts every week, not only with me, but with the people I interview on the podcast. So if you like our podcast guests, they're all invited for a live Q&A session to help you through your menopause journey. Get a second opinion. Some of these people cost hundreds or thousands of dollars to see, and we have them for free in our community. So I have a link to the Biohacking Menopause membership group. Please join us. I would love to see you there. So if you found this episode helpful, please share it with a friend who's thinking about HRT or who's been using it, feeling the side effects. It may just help her navigate this journey with a little bit more confidence. So thank you for spending your time with me. I deeply, deeply appreciate you. I wouldn't be here if it weren't for you. So thank you so much. And if it's not too much to ask, could you leave a review on Apple or Spotify? It helps us get the message out to more women who need to hear it. So thank you so much, and I'll see you next time.